Centers of Excellence were created essentially to achieve two main goals. One was to make it easier for patients who are struggling to find the answers they need to identify medical centers that have deep and broad expertise and might be able to help address either the diagnosis or the treatment of nearly any disorder. The second goal was to enable rare disease clinicians and scientists to work together in a cooperative fashion and share expertise. We believe that this will allow faster progress than each center working in isolation by itself. Our goal was to identify centers that have the breadth of expertise to handle a wide variety of conditions, including those things that are undiagnosed and diseases that are not yet identified. Therefore, the application had more than 100 questions and gave us a lot of information about each institution. Remarkably, a number of the institutions volunteered that they learned something about themselves in completing the application. Ultimately, the applications were scored and we designated 31 centers. They have unique pockets of expertise, but they each also have this sort of broad coverage. That was the goal. There were several different criteria. I've said something already about having a breadth of clinical expertise, but we also wanted these to be centers that were actively engaged in rare disease research, centers that were actively contributing to the training of the next generation of rare disease clinicians and scientists, and centers that were able to provide care across all ages and that had programs to transition pediatric patients to appropriate adult care. We also asked in the application about centers' efforts to provide education about rare diseases to the public and to reach out to underserved minorities, since we think that those are goals that every rare disease center of excellence should have. It was a selection criterion that the centers have the capacity to cover a broad range of diseases. However, we recognize that for very rare diseases, there tend to be pockets of special expertise, and we're not under the illusion that all of the centers will be equally experienced with every disorder. That's where the sharing of knowledge and expertise really comes in. So currently, physicians and other caretakers involved in rare disease will share information. It's not something that is reimbursed. It's not something that's even necessarily valued by your home institution. It's something you tend to do on top of all your other responsibilities, is, provide advice. By bringing the groups together into a network, we hope to incentivize and make it more or even more part of the norm that within the network, clinicians can turn to other sites for advice. Therefore, while patients might in the past have felt the need to travel 1,000 or 2,000 miles to a center that has, let's say, a little bit more experience with their disease, now if they reach one of the centers with the sharing of information for many or all needs, that may be enough. So we do hope to limit the travel, share experience. The European reference networks for rare diseases have a mantra, which is the patients don't travel, the expertise does. Now in the US, we have our own medical system with different insurance barriers and other kinds of limitations. I'm not saying patients will never have to travel, but it is a goal of the network to share expertise so patients can get the same very high level of care without traveling quite as much.